Hello, everyone, and welcome to the July 2021 episode of the NBA's smash hit new video program, All Around Newtown. I'll be your host today, Matt Peters, and today on All Around Newtown, we're going to be speaking with Dr. Jenn Perna from Vivid Women's Health, and she'll be giving us a very informative and I'd say educational presentation on returning to activity after pregnancy. So it's a very, very important topic that will affect a lot of people at some point in their life. Some people will affect them multiple times. So in just a brief moment, we'll get into that video featuring Dr. Jenn. And before that, we're going to go over some quick NBA member announcements. So the first member announcement I'd like to go over with you would be an upcoming event on July 22nd, Thursday, July 22nd from 7:30 to 9 a.m. at Potential Inc. There will be the next NBA breakfast meeting. It will be an in-person event, although attendance is limited to only 30 people. If and when that limit is reached, attendance will then be kind of in a spillover to Zoom. So make sure you go onto the NBA's website, newtownba.org, right now and register to make sure you could attend, because you won't want to miss this one. The topic of the speaker's presentation for that event will be State of Newtown, a government report, and it will be featuring some very familiar names. It'll feature PA State Senator Steve Saniciero. It will feature PA State Rep Perry Warren. It'll feature as well Newtown Borough Mayor Corky Swartz and also Newtown Borough Council President Tara Grundy McLaughlin. So you'll definitely want to make sure you turn out to that one in person. Remember, that's Thursday, July 22nd from 7:30 until 9 a.m. Then after that, the next Emerging Leaders Happy Hour will be on Friday, August 6th from 4 p.m. until 6 p.m. And that will also be in person. That'll be at Triple Sun Spirits in the borough. The next business card exchange, the next NBA business card exchange will be on Wednesday, August 11th from 5 until 7 p.m. And that will be in person at Designer Game Rooms. And the August episode of All Around Newtown, everyone's favorite video program, will be premiering the third Thursday in August. So that will be August 19th, will be the third Thursday. It'll be 11 a.m. It'll be on Facebook, and then after that, just as all of these videos are, they will then be shared to the NBA's Instagram and also their YouTube page. So you definitely want to make sure you tune into that one to see our August presenter, Yogamazia, which is actually a brand new business to open in Newtown. Their owner, Michelle, will be talking about the benefits of children doing yoga, the benefits of yoga for children. So it's definitely one you won't want to miss. And it actually features a brand new business that just opened its doors this year, Yogamazia. It's a wonderful business. I urge you to go check them out. And that's it for all the events. One other NBA member announcement we do want to bring you through to is the NBA Virtual and Live Business Expo. It's coming up and it's approaching rapidly. The deadline to register for the Business Expo is August 13th. You can sign up to be an exhibitor, or you could sign up to be a gold level sponsor for the event. There are more details up on the website, newtownba.org. And remember, all NBA members can register for a free virtual booth, so you could be an exhibitor and not pay a single dollar. And the event sponsorship, which is a gold level sponsorship, you get a lot of stuff in that package. And I urge you to go to newtownba.org and check that out and support that event. Then besides that, the only other member announcement I have is the text alerts, which I tell you about every single video. Text the phrase NBA to the number 844-574-6291. That's NBA to 844-574-6291. You could also find the number on the website as well. And lastly, make sure you check out the NBA Business School podcasts on the NBA website, newtownba.org. You can also find them on Anchor, Spotify, or wherever else you get your podcasts. If you'd like to learn more about the NBA Business School podcasts and how you can be on one and have your very own podcast to feature a topic that you're an expert in, contact Rodney Warner, and he'll set you up and educate you on the whole process about that. So that's it for NBA member announcements. We have a lot of in-person events coming up. We have the virtual and live business expo coming up in the fall. It's an exciting time for the Newtown Business Association. It's us, and it's also a very exciting time for Newtown as well. So now with all those announcements out of the way, let's head on over to Vivid Women's Health and let's hear what Dr. Jenn Perna has to tell us about returning to activity. And that's all kinds of activity, whether it be running or just any other activity after pregnancy. Here we go.
Hi there, my name is Jennifer Perna, and I am a doctor of physical therapy and owner of Vivid Women's Health in Newtown, PA. We are located at the Atrium, which is 4 Terry Drive in Newtown. And so we're a team of physical therapists that specialize in treating conditions involving the pelvis, lower back, and hips. And we treat a variety of conditions and concerns, such as those regarding bowel, bladder, pain, and sexual function. And so, one of the main things that we specialize in, and one of the main populations that we help to treat, involve the pregnancy and postpartum population. And we help these patients address concerns that are regarding their bowel, bladder, and sexual function, as well as with pain and any sort of underlying pain concerns that they may be experiencing during and after pregnancy. And so, as we know, during pregnancy, the body does go through a lot of changes, from hormonal changes to changes in muscles to changes in ligamentous support that's surrounding the pelvis, the pelvic girdle, the back, the hips, all of those things. So, after delivery, when we give birth to the baby, regardless of whether we delivered vaginally or via cesarean, there was trauma to the tissues and to the tissues of the core, to the hips, to the pelvic floor. And so pelvic floor therapy helps to rehabilitate these areas. And so just as we would receive physical therapy if we sprained our ankle or if we injured our knee, we should also be getting physical therapy after pregnancy. And so that's one of the main things that we treat here at Vivid Women's Health is we help our patients recover fully from pregnancy in order to allow them to live very active, healthy lives and help them kind of navigate through their new journey as a parent. And so what we aim to do in pelvic floor therapy is to improve the support and the strength of the muscles and joints surrounding the pelvis and the lower back. And so often patients will have a 6-week postpartum check with their OBGYN or their birth provider. They'll a lot of times get clearance to resume normal activities such as exercise, intercourse, things like that, but they're often not given a framework on how to progress to those activities. They might be apprehensive, they might be in pain. And so pelvic floor therapy helps to kind of bridge that gap between immediately being postpartum and then resuming your normal activities and progressing to an activity level that you would like to progress to postpartum. And so we really help them to achieve activities such as exercise and higher level activities such as running and jumping. And we often, like I said, bridge that gap between the 6-week all clear and the actual ability to perform these activities. And so since birth is trauma, our body needs time to heal. It needs that help to recover from such trauma. And running is a great example of an exercise that seems very inherent from more of like a muscle and function perspective. However, it's very intense and taxing for our system. And so it's not something that you can just get into without any sort of training. And we would expect in a non-pregnant and non-postpartum individual that this would be an activity that does require some training and that does require a little bit of guidance in how to even get into an activity like running. And that's especially important in the situation of a postpartum person. So we want to make sure that we're encouraging safe return to exercise and to any exercise, even if this is the first time that a person is going about exercising. And so running is a really wonderful exercise. I know a lot of people kind of knock running. They say running's bad for your joints and all of these things. And I always say if you're running with good technique, running is very functional. I think it's actually a very wonderful form of exercise. It has a lot of good benefits for building bone density, which is very important as we age. But it's also a really wonderful form of cardiovascular exercise. And so we want to be encouraging our patients to be as active as they want to be, and making them feel very confident within their bodies is one of the things that we do help address. And so when we're talking about returning to running, oftentimes we can either be really scared of running and therefore never trying it, or we can be progressing to this activity way too quickly. And if you progress to something far too quickly, oftentimes we'll hear that patients are just antsy and they're anxious to try to get back into running. And so we'll hear these stories about patients returning to running 4, 6, 8 weeks postpartum. And I always caution patients against that because, yes, we might be quickly jumping into it, but you're setting yourself up actually for an injury. And if you set yourself up for an injury, then what's going to happen is you're either going to halt or completely discontinue running because you're now dealing with an injury. And so we want to encourage a safe return to running or any sort of sport in the postpartum time period. There's many things to think about postpartum. One is the fact that we just had a baby and that muscles of the core, the pelvic girdle might be a little bit stretched, but we're also dealing with hormonal changes. And in a woman that might be breastfeeding, for instance, your hormone level is actually the estrogen actually is decreased in that person. And that sets a person up for actual stress fractures and things like that. So if we progress to running a little bit too quickly, we can end up putting ourselves at risk for developing a stress fracture. And a stress fracture is going to get you out of running a lot faster than you'd want it to. And so we really want to encourage the safe return to running to make sure that we're doing things appropriately and that we're not setting ourselves up for these injuries. And so, as I mentioned, running and jumping, they're great activities. They're wonderful for bone density, for cardiovascular fitness. They're functional. But we want to make sure that if you have a passion for running, that we're encouraging you to do it in a safe manner so that we don't risk for injury. And so, as I always say, if we rush into it too quickly, then we're going to have that injury, and then we risk not having a long and successful running career. And so, because running is essentially repeated hopping on one foot, we want to make sure that the system and the body is actually ready to handle such an activity. And in 2018, there were some great researchers out of the United Kingdom that came in and they did a nice return to running guideline. And within that guideline, they've really, set the stage for encouraging patients to wait at least 12 weeks postpartum in order to allow for adequate healing to happen to the pelvic floor and the postpartum body. And my typical recommendation is that at that 6-week postpartum time period, or whenever a patient is cleared by their birth provider, we can begin starting to work on the core, on the pelvic floor, on proper breathing, on proper hip strength and mobility. And then from there, we can progress the body to run. And typically we do start training in pelvic floor therapy, the breath and how a person is breathing, because there's a very significant connection between the diaphragm and the pelvic floor. And so how somebody is breathing and the rate and the depth of that breath can actually really dictate how their pelvic floor is contracting and relaxing. And so we want to encourage this natural synergy to happen prior to somebody going out and running. It's a common misconception that you should be Kegling or contracting your pelvic floor as if you're going to stop the flow of urine the entire length of a run. So a lot of times patients are told, oh, just try to hold the Kegel the entire time that you're running. And this, unfortunately, is not realistic. This is not how our body functions in its natural state. So it does function naturally with our breath. And so we want to try to encourage that coordination to happen so we don't have to think so hard about running. We also need to make sure that a patient can control their body, that they can control squatting, that they can control balancing on one foot to make sure that there's no compensations within the system while they are running. And so we want to make sure we're avoiding pain, that we're avoiding pressure, that we're avoiding anything that could be causing any stress to the system. And so once we make sure that a patient's breath is properly coordinated with their pelvic floor contraction and relaxation, we then progress to more functional activities such as squatting, standing on one foot, and then progressing to more of the plyometric hopping, jumping activities. And we want to make sure that during these tasks, patients are not experiencing pain, pressure, heaviness, or any sort of concern within the pelvis, the back, the hips, the knees, really anywhere within the body. And so we really encourage a lot of strengthening of the hips, the legs, the feet, the core to make sure that a person is controlling their body when they're running. And then they're also performing it with a good breath. And so once we clear somebody to run, we then help them progress their mileage safely. And through that, we often will have a patient that does want to take their little one out running with a jogging stroller. And I do caution anyone against just resuming running with the jogging stroller. The reason for that is your center of gravity and your stride shifts when you're running with a jogging stroller. So when you're trying to run while you're pushing something, you can actually kind of throw off the system a little bit. And that's not really encouraged. And the reason for that is because your body is still trying to heal from being pregnant. And so if you're then going and running with a jogging stroller, it's just another variable that can really throw off the system. So kind of in summary, what are some good postpartum return to running tips? I would say wait 12 weeks postpartum before you start resuming any running. You want to make sure you're walking before you're running. So don't just go into running. We want to make sure that we're able to control your center of gravity in a squat, standing on one foot, then hopping before we end up getting to the running phase. We also want to make sure that you're strengthening. Oftentimes runners are notorious for this, that they'll just go out, they'll run, and they won't worry about strengthening or stretching or any of those components. And that's particularly important, especially in the postpartum person, that hormone levels are a little bit declined. And as a result of that, we are putting ourselves at more risk of injury. And so we want to make sure that we're strengthening our system in addition to running. And then I obviously encourage working with either a personal trainer or a pelvic floor therapist that's specifically trained in working with patients who are postpartum. So there's a ton of physical therapists out there. We want to just make sure that you are going to a physical therapist that is trained and specifically works with your condition. And we want to make sure that that person does have the advanced training to work with someone that is postpartum to understand all of the variables that are considered in that person. So if you have any questions or concerns regarding pelvic floor therapy, regarding return to running postpartum, regarding just the pelvic floor in general, we would love to hear from you. My company's name is Vivid Women's Health. We are right in Newtown. And so if you have any questions, feel free to reach out. Thank you so much.